This is the CodeBreaK 100 study, and it's the update on the patient-reported outcomes. It's a corollary to the approved drug, which just came out around the same time, that goes along with the efficacy. We reported on the efficacy in a separate presentation, and this is, again, reporting on patient-reported outcomes and how well the patients did. So it demonstrated, in essence, that the quality of life and other metrics that we typically use for patient-reported outcomes were very favorable, going along with the efficacy of the drug. So during this study, what we used is we used patient-reported questionnaires and followed symptoms along with the patient outcomes that were reported separately. So the key findings that, if anything, side effects of sotorasib was actually very good. It was not a lot of side effects. It was very well tolerated, meaning that, not only do we have a drug that works in this patient population with an unmet need, but it did not adversely affect quality of life. In fact, quality of life was actually improved with treatment with the drug, which is what you would want with a targeted therapy. What these results basically showed was that sotorasib is an efficacious drug that is very well tolerated. So physicians and clinicians should have very little reluctance about using the drug, in that it does improve quality of life and the side effects are very tolerable. So again, we have an approved drug that is tolerable, which is what you would want in a tolerated therapy. And to remind everybody, this until the approval of this drug, KRAS treatments did not exist. So it's a huge unmet need. So we now have an approved drug for these KRAS G12C mutants, which represents between 10 to 15% of the lung cancer population. One of the most important things regarding this study is, now that we have a targeted therapy that's very well tolerated, to remind everybody to test. You can't use a targeted therapy if you're not testing for these mutations. So please, reminding everybody to test, either be a tissue or blood or whatever means you have.